The IoT programme, the whole idea behind it is to support people in their academic clinical careers. So the starting point for that in the IoT programme are what are called ACF posts, Academic Clinical Fellow posts. And these are for people at a relatively early stage of their clinical training. Importantly, they last for 3 years and give people 25% of that time absolutely protected to undertake research and do academic time. And then the next level of posts are called clinical lecturer posts or CL posts, which are postdoctoral ones after someone's done a PhD. And those last for 4 years, giving 50% of that time protected academic time. And that's when individuals are getting towards the end of their clinical training. And ultimately what this is about is training the clinical academics of the future, and people will go on to become clinical academic consultants and leading their own research groups.
So I think my first introduction to research was my intercalated master's degree during university. I really enjoyed the problem solving associated with research. I really enjoyed doing the experiments in the lab. And from there, with the help from my supervisor and mentors, I've kind of continued the research that we do during my clinical training. The research that we're currently involved with involves the treatment of a rare type of cancer called sarcoma. Surgery is a really important area of management to try and resect all of the tumour, and our research is looking at using a special dye that we inject into patients before the operation, and then using a special camera during the operation. It allows the tumours to glow, and the aim is to guide surgeons in the resection of these tumours.
So I'm currently a clinical lectureship. I first applied for the clinical fellowship in Newcastle in 2018 and moved up here from London. Combining that with a clinical career in paediatric immunology is absolutely perfect, because that's where the children that have conditions that affect T-cell development present. So they present in paediatric immunology. I then get to be a detective in the hospital, working out why children are sick, but also in the lab, working out why certain completely novel genetic defects cause problems with the T-cells developing. The research that I do and that others do is absolutely integral to patient care. The training it has provided me in my critical thinking, in how I approach problems, how I solve problems, it's formed me, and I think I'm probably a different doctor as a result of it.
Well, here in Newcastle we're really proud of the sort of personalised approach that we take. So we will always try and match up someone who's been appointed to an ACF post, for example, with an appropriate supervisor that is a good match for their research interests. You've got to be motivated, you've got to be interested in the work that you're doing and be in the best environment and team to do that.
So I think in terms of balancing surgical training with research, it's a challenging endeavour, and I think my mentors and supervisors have been really supportive in helping me achieve that. Here in the North East, one of the massive benefits is the flexibility that it's given me. So during my first year of my ACF, I took a block of research time out to do some lab work, and I think it's that flexibility that's really been key to allow me to get the most out of my ACF.
As well as all of the amazing facilities and the proximity of the hospital and being at the forefront of my field, I can afford a house, I can swim in the sea most of the summer. My kids go to an amazing nursery that I'm not having to get a second mortgage for. I cycle to work. I absolutely love what I do, and I think that that is really important. Absolutely, I want to be doing the best science at the best place, and that is why we came here, but I am definitely staying for all of those reasons.
So I think the Academic Clinical Fellowship here in the North East is an excellent programme. If you're interested in doing your surgical training up here and would like a research component to that, I don't think there's a better programme out there.